Welcome to Nurse's Lab. This section explores the essential steps required for effective preparation for nursing licensure examinations, including the NCLEX and Prometric exams. These examinations are crucial for obtaining a practice license as a registered nurse in various Western countries through the NCLEX RN examination and the Pearson VUE Prometric examination in Middle Eastern countries. In this discussion, particular emphasis will be placed on the quiz-type examination methodology as it pertains to the endocrine system. This approach is designed to help candidates build confidence and competence in tackling endocrine system questions commonly encountered in licensure exams. Now, let's start with our questions. Question 1. A client with type 1 diabetes reports sweating, tremors, and confusion. Blood glucose is 48 milligrams per deciliter. What is the nurse's priority action? Option A, administer IV insulin. Option B, provide 15 grams of oral glucose. Option C, encourage ambulation. Option D, document findings. Correct answer, option B. Now let's see its explanation or rationale. Explanation for option B. Oral glucose treats hypoglycemia rapidly. Explanation for option A. Insulin worsens hypoglycemia. Explanation for option C. Ambulation increases glucose use. Explanation for option D. Documentation occurs after intervention. Question 2. A client with hypothyroidism is prescribed levothyroxine. Which teaching is most important? Option A. Take this medication with food for best absorption. Option B. Take the medication at the same time each morning. Option C. Stop the medication if you feel nervous or shaky. Option D. Double the dose if you miss one. Correct answer, option B. Now let's see its explanation or rationale. Explanation for option B. Consistent morning dosing improves absorption and effectiveness. Explanation for option A. Food decreases absorption. Explanation for option C. Nervousness may indicate excess dose. Provider should be notified, not stopped abruptly. Explanation for option D. Doubling dose is unsafe. Question 3. A client with Cushing's syndrome is at risk for infection. Which interventions should the nurse implement? Option A. Monitor temperature regularly. Option B. Encourage hand hygiene. Option C. Restrict visitors completely. Option D. Assess for wound healing. Option E. Provide fresh flowers in the room. Correct answers, options A, B, D. Now let's see its explanation or rationale. Explanation for option A. Fever may indicate infection. Explanation for option B. Hand hygiene prevents transmission. Explanation for option D. Poor healing is common with Cushing's. Explanation for option C. Visitors allowed with precautions. Explanation for option E. Fresh flowers may harbor bacteria. Question 4. A client with hyperthyroidism reports heat intolerance and weight loss. Which nursing intervention is most appropriate? Option A. Provide cool environment. Option B. Encourage high-calorie meals. Option C. Restrict fluids. Option D. Position client supine. Correct answer, option A. Now let's see its explanation or rationale. Explanation for option A. Cool environment reduces discomfort. Explanation for option B. High-calorie meals are helpful but not immediate comfort. Explanation for option C. Fluids should not be restricted. Explanation for option D, position client supine does not relieve symptoms. Question 5. A nurse is preparing to administer insulin to a client with diabetes. Place steps in correct order. Option A, verify provider's order. Option B, select correct insulin type and dose. Option C, perform hand hygiene. Option D, administer insulin using proper technique. Option E, check client's blood glucose. Correct order is options A, E, B, C, D. Now let's see its explanation or rationale. Options A, order verified first. Options E, blood glucose checked before administration. Options B, correct insulin prepared. Option C, hand hygiene performed. Option D, insulin administered safely. Question 6. A client newly diagnosed with Addison's disease says, "I'm afraid I'll never live normally again." What is the nurse's best response? Option A, don't worry, you'll be fine. Option B, tell me more about your concerns and what living normally means to you. Option C, you should avoid thinking negatively. Option D, I'll ask the provider to prescribe medication for anxiety. Correct answer, option B. Now let's see its explanation or rationale. Explanation for option B, encourages therapeutic communication. Explanation for option A, false reassurance. Explanation for option C, minimizes feelings. Explanation for option D, medication may help but does not address emotional need. Question 7. A client with diabetic ketoacidosis has K level of 2.8 MEq per L. Which intervention is priority? Option A, administer IV insulin immediately. Option B, provide oral potassium supplement. Option C, initiate IV potassium replacement. Option D, encourage ambulation. Correct answer, C. Now let's see its explanation or rationale. Explanation for option C. Hypokalemia is life-threatening. IV replacement required. Explanation for option A. Insulin worsens hypokalemia if given before replacement. Explanation for option B. Oral potassium is too slow. Explanation for option D. Ambulation unsafe with hypokalemia. Question 8. A nurse is teaching a client with type 2 diabetes about lifestyle modifications. Which statement indicates correct understanding? Option A, I should monitor my blood glucose regularly. Option B, I can stop exercising if I feel well. Option C, I should avoid reporting side effects of medications. Or option D, I only need to follow diet when my glucose is high. Correct answer, option A. Now let's see its explanation or rationale. Explanation for option A. Regular monitoring prevents complications. Explanation for option B. Exercise should be consistent. Explanation for option C. Side effects must be reported. And explanation for option D. Diet must be followed consistently. Question 9. A nurse is delegating tasks to a UAP for a client with diabetes. Which task is appropriate? Option A, teach client about insulin administration. Option B, report client's intake and output. Option C, adjust insulin dose based on glucose. Option D, provide dietary counseling. Correct answer, option B. Now let's see its explanation or rationale. Explanation for option B. UAP can report intake output. Explanation for option A. Teaching requires RN. Explanation for option C. Insulin adjustment requires RN/provider. Explanation for option D. Counseling requires RN. Question 10. A 55-year-old client with hyperparathyroidism presents with bone pain and serum calcium of 12.5 milligrams per deciliter. What is the nurse's priority action? Option A. Administer prescribed IV fluids. Option B. Encourage high calcium diet. Option C. Provide oral vitamin D. Option D. Position client supine. Correct answer, option A. Now let's see its explanation or rationale. Explanation for option A. IV fluids reduce calcium levels and prevent complications. Explanation for option B. High calcium diet worsens hypercalcemia. Explanation for option C. Vitamin D increases calcium absorption. Explanation for option D. Position client supine does not improve condition. Question 11. A client with type 2 diabetes reports polyuria, polydipsia, and blurred vision. Blood glucose is 320 milligrams per deciliter. What is the nurse's priority action? Option A. Administer prescribed insulin. Option B. Provide oral fluids. Option C. Encourage ambulation. Option D. Document findings. Correct answer, option A. Now let's see its explanation or rationale. Explanation for option A. Insulin lowers glucose and prevents complications. Explanation for option B. Fluids help but do not address hyperglycemia. Explanation for option C. Activity may worsen hyperglycemia. Explanation for option D. Documentation occurs after intervention. Question 12. A client with hyperthyroidism is prescribed propranolol. Which outcome indicates effectiveness? Option A. Decreased heart rate and tremors. Option B. Increased weight gain. Option C. Reduced thyroid hormone levels. Option D. Improved bowel movements. Correct answer, option A. Now let's see its explanation or rationale. Explanation for option A. Beta blockers reduce tachycardia and tremors. Explanation for option B. Weight gain is long-term effect of treatment. Explanation for option C. Propranolol does not lower thyroid hormone. Explanation for option D. Bowel changes are not primary effect. Question number 13. A client with diabetes is admitted with a foot ulcer. Which nursing interventions should the nurse implement? Option A. Perform wound care using aseptic technique. Option B. Encourage daily foot inspection. Option C. Restrict visitors completely. Option D. Monitor for signs of infection. Option E. Keep feet soaked in warm water daily. Correct answers, options A, B, and D. Now let's see its explanation or rationale. Explanation for option A. Aseptic wound care prevents infection. Explanation for option B. Daily inspection prevents complications. Explanation for option D. Infection risk is high. Explanation for option C. Visitors allowed. Explanation for option E. Soaking increases the risk of skin breakdown. Question 14. A client with hypothyroidism reports fatigue and cold intolerance. Which nursing intervention is most appropriate? Option A. Provide warm blankets. Option B. Encourage high-fat diet. Option C. Restrict fluids. Option D. Position client supine. Correct answer, option A. Now let's see its explanation or rationale. Explanation for option A. Warmth improves comfort. Explanation for option B. High-fat diet not recommended. Explanation for option C, fluids should not be restricted. Explanation for option D, supine position does not relieve symptoms. Question 15. A nurse is preparing to administer glucagon to a client with severe hypoglycemia. Place steps in correct order. Option A, monitor blood glucose after administration. Option B, verify provider's order. Option C, perform hand hygiene. Option D, prepare glucagon injection. Option E, administer injection IM or subcutaneously. Correct order: B, C, D, E, A. Now let's see its explanation or rationale. Option B, order verified first. Option C, hygiene performed. Option D, medication prepared. Option E, injection administered. Option A, glucose monitored for effectiveness. Question 16. A client newly diagnosed with diabetes says, "I'm overwhelmed by all the changes I need to make." What is the nurse's best response? Option A, don't worry, you'll adjust quickly. Option B, tell me more about which changes feel most difficult for you. Option C, you should focus only on the positives. Option D, I'll ask the provider to prescribe medication for anxiety. Correct answer, option B. Now let's see its explanation or rationale. Explanation for option B, therapeutic communication encourages expression. Explanation for option A, false reassurance. Explanation for option C, minimizes feelings. Explanation for option D, medication may help but does not address emotional need. Question 17. A client with pheochromocytoma develops severe hypertension and headache. What is the nurse's priority action? Option A, administer prescribed antihypertensive medication. Option B, encourage oral fluids. Option C, provide emotional support. Option D, document findings. Correct answer, option A. Now let's see its explanation or rationale. Explanation for option A, antihypertensives reduce life-threatening blood pressure. Explanation for option B, fluids do not address hypertension. Explanation for option C, support is secondary. Explanation for option D, documentation occurs after intervention. Question 18. A nurse is teaching a client with diabetes about sick day management. Which statement indicates correct understanding? Option A, I should continue taking insulin even if I don't eat. Option B, I should stop insulin if I vomit. Option C, I should avoid checking blood glucose when ill. Option D, I should restrict fluids to prevent nausea. Correct answer, option A. Now let's see its explanation or rationale. Explanation for option A, insulin must continue to prevent DKA. Explanation for option B, stopping insulin worsens hyperglycemia. Explanation for option C, glucose must be monitored more frequently. Explanation for option D, fluids should be encouraged. Question 19. A nurse is delegating tasks to a UAP for a client with hypothyroidism. Which task is appropriate? Option A, teach client about levothyroxine therapy. Option B, report client's bowel movement frequency. Option C, adjust medication dose. Option D, provide dietary counseling. Correct answer, option B. Now let's see its explanation or rationale. Explanation for option B, UAP can report observations. Explanation for option A, teaching requires RN. Explanation for option C, medication adjustment requires RN/provider. Explanation for option D, counseling requires RN. Question 20. A 60-year-old client with diabetic ketoacidosis, DKA, is admitted with Kussmaul respirations and fruity breath odor. What is the nurse's priority action? Option A, administer IV fluids. Option B, provide oral glucose. Option C, encourage ambulation. Option D, document findings. Correct answer, option A. Now let's see its explanation or rationale. Explanation for option A: IV fluids restore perfusion and treat dehydration. Explanation for option B: glucose worsens hyperglycemia. Explanation for option C: ambulation unsafe. Explanation for option D: documentation occurs after intervention. Thank you for engaging with this section on nursing licensure examination preparation. We appreciate your dedication to advancing your knowledge and skills and hope that this discussion on the quiz-type examination questions for NCLEX RN and Prometric and Endocrine System has provided you valuable insights. Wishing you the very best in your studies and future nursing career.